students to Lesson 6 of Pet Responsibility. We're so glad that you chose to join us. Today, we're coming from Pinehurst Animal Hospital. A little bit later on, we're going to have a chance to have a tour of the hospital, which will be great. You're going to be able to see some things that most people never even see in an animal hospital. And we're going to meet some very important people who work here at Pinehurst Animal Hospital. So, before we get started with that though, let me ask you a question. Do you remember what the sad problem is in Moore County? What was the sad problem here? I bet you're saying the sad problem is that there are too many dogs and too many cats, and there are too many dogs and cats that people don't really take very good care of. If you said that, you're right. And in our lessons, we talked about all the things that people should do to be a responsible pet owner. I want you to think about some of those things that people should do to be a responsible pet owner. Think of 1, 2, 3, maybe 4 or 5 things. Like for example, you might have thought of, I've got to give my pet good nutritious food. I need to give my pet clean water. I need to take my pet out to exercise, go for a walk. Responsible pet owner makes sure that their pets have flea and tick medicine and that they have heartworm medicine. One of the things you absolutely have to be sure of is to spay and neuter your pets. Because remember, we talked about that really being the solution to the pet overpopulation problem in Moore County. Oh, one other thing I bet you thought of, since we're standing in front of Pinehurst Animal Hospital, I bet you thought that, oh, I need to take my pet, people need to take their pets to the veterinarian once a year, at least once a year, and maybe more if they're having some problems. So now that you know all about what it takes to be a responsible pet owner, you're an advocate. You learned about that in the last lesson. And so you're responsible for telling people about how to take care of their pets. You're being an advocate. And speaking of being an advocate, I'd like to introduce our first guest. Come on over here, Miss Jessica. This is Jessica McDaniel, and Jessica is a certified veterinary technician here at Pinehurst Animal Hospital. Why don't you tell us what you do here?
Yeah, so a certified veterinary assistant is a support staff member on the medical team here. We help the veterinarians with the treatment of our patients, and so at any given day I might be holding an animal for restraint, comforting an animal while they're having a treatment done, running some blood work for the doctor, assisting in x-rays, assisting in surgery, filling prescription medication. So we do a little bit of everything here.
How did you learn how to be a vet tech?
So I started at a community college in eastern North Carolina about 12 years ago. I went for a certified veterinary assistant certification course. And that certification course was about 6 months long. During the certification course, I did an internship at a veterinary hospital that later offered me a job, and most of my training since then has been on-the-job training.
So when you're talking about some of the things that you do, kind of sounds like you're like a nurse almost.
Yeah.
Like when the boys and girls go to the doctor, you go to your pediatrician.
Yeah.
A lot of times you have a nurse that helps the doctor. Is that kind of like what you do?
Yeah, I think that's a great analogy. It would very much be like a nurse, and there's actually just a fun fact. They're actually trying to start calling veterinary technicians veterinary nurses now.
Maybe you'd like to be one of the first veterinary nurses. So what do you like about your job?
What do I not like about my job?
You like everything.
I like everything about my job. I would say probably the thing I like the most about my job is the fact that I get to help pets and people. A lot of the pets that come to our facility have people, all of them have people that bring them here, and those pets are important to those people. And so when I'm helping their pets, I feel like I'm helping people too.
Is there anything that sometimes you don't like about doing your job?
Yeah, sometimes we see some pets that haven't been cared for as well, or maybe a pet that hasn't been spayed and has a litter of unwanted puppies, or a heartworm positive dog that hasn't been given heartworm preventative. So that's kind of sad.
And that's all the things that we talk about in being a responsible pet owner, is making sure that their pets are spayed and neutered, making sure that they take heartworm medicine. So you are really an advocate
Yeah.
for
Yeah.
pets.
Yeah.
Well, we appreciate that you do that. And now we're kind of excited to take a tour. Can we do that?
Yeah, of course. We're excited you're here. We love to show what we do here at our hospital. So come on in.
Thank you. We'll be right back.
One.
Well, students, we're inside the Pinehurst Animal Hospital, and we're in the waiting room. And this is the first space that people come into with their pet. Can you tell us a little bit about the waiting room?
Yeah, so when people bring their pets to our facility, they come into the waiting room. They'll be greeted by a receptionist that will just kind of make sure we're clear on what they're here for their appointment, make sure there's no previous medical history that we need to have on file. We'll get their pet's weight and ask them to have a seat until the doctor's ready to see them.
Why is it important to have the weight of a pet?
The weight is extremely important, and a current weight is extremely important too, Barb. We use those weights to calculate drug doses for anesthesia, for heartworm preventative, for medications that we prescribe, and it's also a good way to know if your pet's trending in the right direction as far as keeping a healthy weight too.
A little like my pet.
Yeah.
Students, my pet was very overweight. And so because of Dr. Iopplo and Dr. Means, we put my pet on a diet, and now she's much healthier.
And you did a fantastic
Thank
job
you.
bringing her in and having her weighed and checking that and keeping up with it. So great job, Barb.
Thank you.
Yeah.
Thank you. So what if someone has an emergency and they come running in the door with an emergency situation?
Well, emergencies are treated a little bit differently. So when an emergency comes in, usually again our receptionists are notified either by phone or when the client walks in that there is an emergency here. They will notify one of our technicians, assistants, or doctors, and somebody will come up immediately and triage or take a temperature.
What does triage mean?
Triage means to get a temperature, a heart rate, respiration rate, kind of assess our patient or look them over, make sure that they're not critical, which would mean life-threatening situation. In that case, if it were, we'd obviously take them immediately back to the treatment room. Sometimes we can say, well, your pet is very sick, but maybe not quite sick enough to need immediate care. Hang tight just a few minutes and we'll be right with you.
So that's all part of triage.
All part of triaging.
So I imagine sometimes then you take the pet into an exam room. And is that where we can go next?
Yeah, of course. We'd love to show you our exam rooms.
Okay.
Thank you for calling.
We're going to go into the... So now we are in an exam room. And Miss Jessica, can you tell us a little bit about this space and what happens here?
Yeah, so after you're have waited in the waiting room for just a few minutes, we'll bring you to an exam room, and this is where you'll hang out and wait for the doctor. The doctor will come in, and this is where they perform their examination, answer any questions that you may have about your pet, and then kind of determine the treatment plan from there. So we can do a few things in here: ear swab, cytologies, clean ears, trim toenails, but most of the action happens a little later on, and we'll get to
we're
there.
going to see that?
Yeah, we're going to go see that.
And from what I understand, we might be coming back into this room a little bit later with some special guests.
You'll have to see.
We'll have to wait and see. So next we're going to go into
X-ray.
X-ray. We'll see you in X-ray. So we just left the exam room, and let's pretend that during the exam, the doctors decided there was something they needed to know a little bit more about. So now we're in the X-ray room. Could you tell us about all of this fancy equipment?
Yeah, so all this fancy equipment really helps us come to a conclusion oftentimes about what is wrong with someone's pet. We take x-rays for a number of different reasons, obviously for broken bones, sometimes for things that we think a dog may have eaten. We can also look at their heart and lungs on x-ray too. So this is our x-ray machine. And
Does this table move? I think you showed me.
it does move, and that way we can move our patients around easier on it. So what we'll do is we'll put a dog or cat on the table, and we can move it around so that it's positioned just exactly like it's supposed to, and then it lights up, we get ready to take the x-ray. Yeah, and then the film is developed. We'll take the picture, the film is developed, and then we have an instant picture of the insides of someone's
So you
head.
can see it very quickly.
See it very quickly, yes.
So what is this machine?
So this is an ultrasound machine, and Dr. Iopplo actually has had special training in doing ultrasounds on pets. This is a more kind of advanced diagnostic, meaning advanced. It gives us a little bit more information than what an x-ray might do. It's kind of a different thing, but similar reasoning we would use it.
They're the same, but they're different.
They're the same, but they're different. Yeah, we look at more, think about an x-ray as being used more for bones and an ultrasound being used more for organs.
So for example, boys and girls, have you ever heard about a dog maybe eating something they shouldn't, like a sock or something like that? Would that be something that you might be able to see?
Definitely,
Yeah.
definitely need an x-ray if we think
Yeah,
they've eaten a
yeah.
sock, so
And
yeah.
what sorts of things do you look for example, with a pregnant dog with a sonogram?
Yeah, so actually, surprisingly enough, a lot of people think the ultrasound is used for pregnancy checks.
Mhm.
I think, and I'm not a veterinarian, this is a better question for Dr. Iopplo, but I think we use x-ray more to count
Oh, do
puppies.
you? Okay.
Yeah, ultrasound would be used for kind of looking at things like the bladder, looking at the liver, spleen, kidneys,
The
things
organs.
like that. Yeah, getting a better
Okay.
picture of the organs. It uses a different, it's kind of a different machine in general. So.
Different technology.
Different technology, for sure.
Well, speaking of technology, our next step is to go into the treatment room, correct?
Correct,
And
yes.
so we'll leave x-ray and we'll see you back in the treatment room. So now we're in the treatment room, and you hear that there are some pets behind us that have had some sort of treatment. Maybe you can tell us a little bit about that. What do you do in the treatment room?
What don't we do in the treatment room? The treatment room is used for a lot of different things, and I think we have some guys wanting to tell us for themselves what we use the treatment room for. Treatment room is used for, it's, you know, as obvious as treating our patients. We use it for getting them ready for surgery, so surgical prep. We use it for doing dentals. We use it for giving them vaccines. I mean, blood draws, just about anything that we can't do. Just about anything that we can't do in the exam room. So yeah, hospitalizing patients, obviously.
So what is this equipment over here?
This is an anesthesia machine. So this is gas anesthesia. Keeps our patients anesthetized for their surgeries.
So, I was just going to say they'll be quiet when we're not talking, but that didn't work, did it?
Barb, I'll tell you what, I have a really special guest that I think is just about ready. You mind if we yeah, I think we're unwelcome here.
So now where are we?
We are in our surgery room, and it is an honor to introduce our next guest, Dr. Tony Iopplo. He is a veterinarian and the practice owner here at Pinehurst Animal Hospital.
Well, thank you for having us in the clinic.
Absolutely.
We've had a great tour, and we really look forward to talking to you about what does a veterinarian do. What were you just doing in here?
We've had a busy day today. We had multiple dental procedures we did where some lost some teeth in the other room. And then in here I had a few spays and neuters. I know y'all know how important that is. And also had a mass removal that I had to do on a dog that had a small tumor. So we were busy today.
You were busy today, and you're still standing or smiling.
Yeah, we just finished.
That's good.
Yeah, it's always fun to be able to do things. When you're doing what you love, it's every day is a good day.
So, What else do you do besides surgery as a veterinarian?
As a veterinarian, we kind of do it all. You know, we see pets coming in for regular puppy vaccinations. We see dogs in for geriatric exams, meaning elderly pets that may have some arthritis or pain that we try to manage. We see pets that may be having disease problems or dermatitis issues or sicknesses that could have been prevented.
What does dermatitis mean?
Dermatitis is a skin infection. So sometimes if pets aren't taken care enough well of, or sometimes if they just have bad skin, they can actually develop certain problems with their skin that may need to be treated with an antibiotic.
So how did you learn how to be a veterinarian to deal with all of these medical issues?
It's definitely a process. And you go through your regular schooling, high school, and then from there you go to college for 4 years. And after college, you go to veterinary school for 4 years. And then after veterinary school, you can either go out and practice like I did and be a general practitioner, where we kind of do it all. Or you can even go and become a specialist. And as a specialist, you do another couple of years of school, and you would do, maybe you'd be a specialist where you just see hearts, like a cardiologist. Or you'd be a specialist where you treat just skin, like we talked about with dermatitis. You'd be a dermatologist. Or you could be a specialist who just does surgery, and that would be just a board-certified surgeon. So there's a lot of different directions you can go, as well as treating other types of species, other than dogs and cats, like large animals you can treat. We have a lot of horse vets in our community. We have some food animal vets, which is like cows and goats, and we have people who treat chickens. You have people who treat exotics, meaning your birds and little pocket pets. So a lot of different directions in veterinary medicine.
So for a career, there are a lot of different things you can do, isn't there?
There's even research. So not every veterinarian goes into practice. Sometimes veterinarians will go into drug research and to come up with all the wonderful things that we have available to us to treat pets with. Or they'll teach.
You know, the boys and girls are watching this video now, and they may be thinking of all these questions that they have for you. So I'm going to kind of take a guess of what you might be thinking about asking Dr. Iopplo. Dr. Iopplo, when did you know that you wanted to be a veterinarian?
I think as a child, I grew up in a medical family. My dad was a physician, my mom was a nurse. We grew up on a small farm in Louisiana. It's a hobby farm, but it was we had cows, chickens, geese, ducks, turkeys, pigs, horses. And then from an early age, we'd have the veterinarian come out to the house. And from there, I always enjoyed working with him and learning how to treat the animals and helping things that can't tell you what's wrong with themselves. I always felt it more of a connection with the animals as opposed to treating the animals as opposed to going into what my mom and dad did, which was human medicine.
So with human medicine, and we'll get back to your questions a little bit later, with human beings, they can tell you, children can tell you, I've got a tummy ache, my leg hurts, or whatever. What about pets?
It's very true. So some people don't realize this, but pets don't have symptoms. They have signs of what's wrong with them. Humans have symptoms. They tell you, hey, my arm hurts, or I got a stomach ache. With pets, we have to, as responsible owners, be able to look at our pets and say, hey, something's not right with little Bella there, or he seems kind of like he's kind of hurting when he stands up. Like maybe he's got some arthritis or a pain in his leg, or maybe just a broken toenail or something. There's a lot of different things owners can pick up about their pets to really help us know what we may need to treat and where we need to focus.
So it's part of the owner's responsibility to pay attention to their pet's behavior, and if they see something that's odd, they should...
Absolutely. The owners are the number one, the first person who knows what's going on. The owners know their pet best. And we're lucky to have some wonderful owners in this community to where they really keep a good eye on their pets. They're a member of the family. They're being taken care of very, very well. So we always have to make sure we get a good history from the owners, because the owners can tell us, hey, this is what my dog was doing, or cat.
So maybe the boys and girls might ask this question: what do you like about being a veterinarian?
There's so many different aspects of it that I enjoy. I really enjoy surgery, as I just finished a surgery right before y'all walked in. I also enjoy all the appointments where I get to not only meet with the people, because a lot of people think as a veterinarian you don't really deal with people, but you actually do. You deal with the people just as much as you deal with the pet. But no, I enjoy the difficulty in trying to get to the bottom of certain types of cases, but I also enjoy surgery, and myself, I really enjoy ultrasonography. Ultrasound is where you would look inside the abdomen. I think y'all saw that a little while ago.
Yeah, we did. Yeah.
So there's a lot of, it's just, everything's kind of like a mystery a lot of times. You have to try and
Detective.
figure out what's wrong with the pet when they can't tell you, and you have to try and fix the problem, sometimes surgically, sometimes you fix the problem with medicine. Sometimes you're just treating with preventatives, like y'all may know about heartworm disease and vaccinations to prevent rabies.
We talked
and
about
other
that,
things.
didn't we? We talked about the importance of giving your pets flea medicine, tick medicine, definitely heartworm medicine, and the fact that rabies shots are the law, aren't they?
It is, yes. And the rabies are very important, as y'all may be aware. I mean, it's still around in our communities and in the United States and other countries.
Another question that the students might ask you is, if there are so many things that you love about being a veterinarian, is there anything that you just sort of don't like a little bit or wish would change?
There are definitely things that in every profession that we may wish, gosh, I wish I didn't have to do that. But as most of you know, sometimes we have to let pets go. So obviously I don't enjoy letting pets go, euthanasia. But then there's also things that we don't enjoy, like when we see a pet that may not be spayed or neutered that should be, like maybe it had an unwanted litter of puppies or kittens, or we'll see a pet that maybe was just not well taken care of, living outside, maybe not getting the quality of care that we would want our pets to have.
What are the most important things that people can do to make sure that their pets live nice, long, happy, healthy lives?
Yeah, I mean, that's a great question. I mean, the most important thing is just making sure that they are aware of what's going on with their pet, and then bringing them in for their required vaccinations and examinations. We recommend seeing them at least once a year. For our puppies and senior pets, we do recommend more than once a year, because that's when, as puppies, they need a lot of visits to get all their vaccinations up to date and fecal exams to check for parasites. And as senior pets, a lot of things can go wrong internally. So bringing them for regular veterinary visits is very important, but also just being with your pet and caring for them and loving them and bathing them and brushing them and just, developing a good bond. A human-animal bond is very important.
So I think that may be the questions that students might ask. I have another question. When we were in the waiting room, we went into the exam room, we went into the x-ray room, we went into the treatment room, and so we sort of saw how animals might progress and then surgery. But we'd kind of like to go back, if we could, go back to one of the exam rooms, because I think we have another guest. And we do.
I think we have another examination to do on another pet.
Okay, so we'll meet you back in the exam room with another special guest. Well, here we are, back in the exam room with a very, very special guest. Who is this, Miss Jessica?
This is Greta. Greta is an 8-year-old dachshund, aka weenie dog. Yeah, she's one of our regular patients here. She is very familiar with Dr. Iopplo, and so she's here for her annual checkup, kind of like Dr. Iopplo had explained earlier.
Absolutely.
So can you show us, what do you do in a regular checkup?
Yeah, so in a regular checkup, we'll come in the exam room. Sometimes they come with just one person, sometimes a whole family. And then we'll kind of get a little bit of history to start out with. We'll say, hey, what's going on with your pet today? I'll greet the pet. I'll say, hey, Greta. And then from there, they'll tell me what the problem is, or maybe we're just here for vaccinations like we talked about. Maybe we'll go in and collect some samples initially, like a stool sample, or a heartworm sample, or sometimes even something from the skin or the ears. But so then when we actually start the exam, we'll start kind of from the front and work our way to the back. Different veterinarians in different ways, but that's kind of my approach typically. So we'll start looking at her and we'll say, just meet her first, make sure she's going to be a good girl. And she is. We already know her. We'll look at her teeth. We'll pick up her lip, look all the way back. And this pretty girl does have some dental disease going on. So I would recommend to her owner that, hey, we probably need to think about a dental cleaning. We do a whole lot of dental cleanings on our dogs. It's really important, especially with how long they live these days, to keep their teeth in good shape. It helps their heart and everything. And then from there, we'll look at her ears and eyes. I'll grab the ophthalmoscope to look in her eyes. That's this instrument. And we'll say, all right, let's look back in her eyes, see her retina and her optic disc. Everything looks really good. No cataracts or anything like that going on in her eyes. So she looks great. And then to look in her ears, I'll use another instrument called an otoscope. There, we'll do that. We'll put it down in there and check all the way down to the eardrum. All right. She's got very clean ears. Come around to the other side. Look down at her ear. Also looks great. A little bit of wax in that one. Next, I would kind of work my way back on the pet. Feel the lymph nodes. They feel normal. Feel her abdomen. We check and kind of get an idea about what kind of body condition she's in, whether she's overweight, normal weight. Feel her belly. Sometimes you can feel things internally when you squeeze on their belly. And then I'll also flex and extend their legs to make sure they're not dealing with some arthritis or some pain in their leg. We'll look at their nails, we'll check their tail, we'll look at her skin underneath. You can even lift up her front end. Let me see her belly. And it looks good. She can get down. So, and then other things obviously we would do would be to check the heart. That's what we would use our... Sounds really good. She's got a very good heart rate and rhythm. Beating very normal. Okay. So from there we would proceed with doing whatever else was needed for her visit today, whether we were going to go ahead and start giving some vaccinations or whatnot.
So with Greta, you would tell the owner, you're doing a good job with this dog.
Yeah, I would tell the owner, hey, you know, Greta looks really good. In this particular case, I may say, hey, it'd be good for her as a Dachshund to maybe lose a few pounds because Dachshunds can have back problems. Every breed has certain problems that we worry about with them. And with Dachshunds, you want to keep them on the thinner side so they don't hurt their backs. And then I'd also recommend, as I said, hey, we might want to do a teeth cleaning down the road. We can set that up where you drop off and go under anesthesia. And then I would always want to make sure with the owners, do you have heartworm prevention? Do you have flea prevention? Are we totally up to date on vaccinations? Do you need the nails trimmed? Other little basic kind of things that we would do on a daily basis.
So you talk to owners also about their diet, and about the food that's good for them or for any special needs that they might have?
Absolutely. We not only their diet, but also sometimes nutraceuticals, meaning supplements. Sometimes we'll put them on joint supplements that may help pets in older age. But a lot of times, as you mentioned, diets, we'll have special diets for certain pets that may help with heart disease, or diets that help with kidney disease, or with liver disease. There's a lot of very specific diets now that they make to, once again, help our pets live longer and have healthier lives.
Well, Greta, hello.
She's such a sweet girl, isn't she?
You're being a very good patient, and we appreciate you being patient with us.
Her mommy and daddy love her very much.
I bet they do. I bet they do. Well, this has been wonderful, hasn't it? A wonderful opportunity to see a real veterinary hospital and to meet the people who work here. It's wonderful to see how much they love these pets. I think you love pets just as much as the owners do. So we want to thank you very much for spending this time with us, showing us around. So thank you very, very much.
Well, we really appreciate y'all joining us in a little snippet of our day here at Pinehurst Animal Hospital. So I hope y'all enjoyed, and if you have any questions, always feel free to give us a call.
Wonderful. And so we will get back together outside in just a few minutes to wrap this up. Well, students, here we are where we started before our tour of Pinehurst Animal Hospital. Wasn't that wonderful to meet Dr. Iopplo and Miss Jessica? They had so much good information. It was fascinating to see inside and behind the scenes at an animal hospital. They take wonderful care of the animals here. And speaking of taking care of animals, do you guys remember the story of Barney and Snowball? Remember we started out our pet responsibility lessons learning about two dogs, a dog and a cat, who ended up at the animal center, the animal shelter, for a couple different reasons. Barney was a beautiful black cat. Unfortunately, his owner died and there was no place for him to go. Snowball, as you might remember, was abandoned. She was found. She was skinny. She was covered with fleas and ticks. She was in terrible shape. And both of them were at the animal center. And as we followed their story, or their tale, we found out that, fortunately, both Barney and Snowball were adopted. It's a wonderful story, and I'm wondering if you're wondering, what are they doing today? Well, today, Mason, who adopted Barney, still loves Barney, of course, and is taking care of Barney, he and his grandmother. And Mason uses every opportunity he has to tell people about being a responsible pet owner. With Snowball, Snowball actually is in training right now to be a therapy dog. She's doing very well. Remember, all of her puppies, all of her 12 puppies were adopted. So both Mason and Michelle, who adopted Snowball, continue to be wonderful advocates for animals, just like we hope you will be. You've learned a lot about being a responsible pet owner. You have a lot of information. You have this folder. This folder is really important. Keep it someplace safe. It's got good information outside, and it's got a lot of good information inside with some wonderful brochures. I have information and telephone numbers. And so part of being a pet advocate is to know these sorts of things and have that information right at your fingertips. So we know that you're going to continue to be, and you are, advocates, that you are going to tell everyone that you know about caring for pets. So on behalf of the Pet Responsibility Team and Pinehurst Animal Hospital and the dogs and pets and cats of Moore County, we thank you. Bye for now.